Good morning, everyone. My name is Bailey Morales, and today I will be presenting on attachment-based play therapy. The major key theorists in attachment-based play therapy combine classic attachment theory with therapeutic play techniques. So it draws heavily from John Bowlby, who emphasized that early attachment experiences shape emotional development, and also Mary Ainsworth, who was the one that developed the strange situation to assess attachment patterns. And more recently, Cochrane, Nordling, and Cochrane integrated these attachment principles into a structured play therapy model. The foundation of attachment-based play therapy is that children develop internal working models based on early caregiving. So secure attachments create emotional regulation and resilience, and attachment-based play therapy assumes that early relational experiences shape a child's view of themselves, others, and the world. Children communicate their inner world through play, which allows therapists to assess attachment patterns and relational disturbances. The therapeutic relationship offers a corrective emotional experience that hopefully fosters secure attachment, emotional regulation, and trust. And play is seen as the child's natural language, and through the therapeutic relationship, we are able to offer those corrective emotional experiences. Parents and caregivers play an essential role in this process, and therapy works to heal attachment injuries caused by potentially trauma, stress, or inconsistent caregiving. Major concepts of the theory. The focus of this treatment framework offered in this model is designed to help children, especially traumatized children, learn to engage in relationship behaviors that are healthy, to help them form secure attachments with their family members, and later on to form healthy relationships with others, as well as looking to their attachment figures to help them learn to effectively regulate their emotions. Most treatment models for traumatized children use an attachment-based framework to support children in learning how to develop healthy social bonds with their parents. And rather than seeing emotional or behavioral struggles as pathology, attachment-based play therapy views them as survival strategies linked to attachment disruptions. So symptoms like aggression or withdrawal are seen as an adaptive response. And in therapy, we help the children develop healthy relationship behaviors, form secure attachments with their family members, and regulate their emotions with the support of the attachment figure. Presenting problems that this model can be utilized for include separation anxiety, emotional dysregulation, trauma, disorganized attachment, and behavioral issues. The theory views functional dynamics as when the child is responsive and attuned to their caregiver, and there is an apparent emotional safety and consistency offered by the caregiver. Dysfunctional dynamics include inconsistent caregiving. When the parent or child is dismissive, chaotic, or potentially over-involved, this will then the child will internalize the negative self-view, either that the world is not safe and therefore there will be no one to take care of my needs or keep me safe, or the other side where the world is not safe, I am not capable of taking care of my own needs and I require my caregiver or parent to keep me safe at all times. So using a $300 budget, I selected key therapeutic tools, which include dolls and a dollhouse to kind of help explore family dynamics, puppets for role-playing emotions, any art supplies for any kind of creative expression. Sand trays can be utilized with their miniatures for symbolic storytelling, and then also potentially emotion cards to expand emotional literacy and the vocabulary of the child, and then also including stuffed animals for comfort, and then also with using that budget with storage bins to help with organization. Each of these items was carefully chosen to help support emotional expression and relational repair within the child in the therapeutic space. The therapy space should feel warm, safe, and inviting. These are two very great examples of a great play therapy space. Essential furnishings include child-sized tables and chairs, a rug to be able to play on the floor, a bookshelf to keep things organized, a sand tray setup, maybe an easel with some art supplies, a puppet stand, the dollhouse, and then just comfortable seating for the child, the therapist, and the caregivers. Also, a very crucial aspect are privacy and or a safe private space to keep confidentiality and create a supportive environment. In attachment-focused therapy, the therapist facilitates parent-child interactions that strengthen the emotional connection. So instead of simply managing behavior, we guide parents to meet the child's underlying attachment needs. The roles of the session include the child, who engages in the symbolic play, while the therapist models secure attachment behaviors, also through play. And then the caregivers will learn how to attune and hopefully respond effectively to their child's emotional world. So attachment-based play therapy is recommended for children aged 4 to 12, but it can be adapted for teens or for older children. Typically, treatment sessions last 12 to 24 sessions, depending on variables like trauma history or attachment disruptions. And the process involves 4 stages. The first stage is engagement and safety. So in the initial sessions where the therapist focuses on establishing trust with the child and the caregivers, this stage also involves creating a safe and predictable and supportive environment where the child feels safe and can express themselves through the play. The second stage is assessment through play. So once rapport is established, the therapist uses play-based activities to observe the child's attachment patterns, emotional regulation skills, relational themes, and areas of trauma or relational disruption. This allows for a nuanced understanding of the child's inner world. And the third stage is parent-child interaction focus. So after assessment, caregivers are actively brought into the therapy sessions, into the therapy process, where the therapist works with the parent or the caregiver to strengthen their attunement and responsiveness. They will teach emotional regulation techniques and repair any attachment ruptures that are seen. And sessions may include joint parent-child play therapy sessions to kind of help model the healthy relational interactions. And the fourth stage is integration and closure. In the final stage, the therapist supports the child and the family in integrating new attachment patterns, emotional skills, and relational behaviors. And then therapy concludes with a celebration of growth, which hopefully will reinforce the child's sense of accomplishment and just strengthen the family's bond overall. Interventions may be non-directive, where the child kind of leads the play, but they also can be more directive, where the therapist guides specific activities to promote attachment repair. Specific activities may include using any of the tools that I mentioned, so the sand tray, puppets, emotional cards, dolls, dollhouse. The art activities, you could include drawing safe people, which may reflect the relationships that are going on, and maybe where parents mirror child's emotions. That's a great activity. Storytelling also helps rewrite attachment narratives for the child, and these parent-child sessions with these activities are just a key part of reinforcing the emotional attunement. Attachment-based play therapy emphasizes cultural sensitivity pretty well. It is able to recognize how race, ethnicity, social class, and intergenerational trauma can impact attachment. Therapists are encouraged to use culturally relevant toys and materials, create affirming spaces for diverse family structures, and actively work to dismantle the barriers to attachment security for marginalized populations. So some concrete ways to incorporate culturally competent care is including diverse dolls and toys of varied races, family structures, genders, and identities. We want to make sure we're using the culturally affirming stories and language to really allow the child to tell their story and experiences without trying to fit them into a box of like what we may think or assume they should be living in. Also, if possible, offering a sliding scale will help address socioeconomic access and make this care really accessible for as many families and children as possible. As therapists, we must adhere to mandated reporting laws regarding abuse, neglect, or danger. It's crucial to obtain informed consent from caregivers and assent from children, and to explain the confidentiality limits clearly. We also must document sessions accurately and practice cultural humility, and also try to avoid pathologizing diverse parenting styles. In telehealth settings, therapists can mail toy kits to families so that they can have the kit in front of them and use it virtually. Also, using virtual sand trays and board games, kind of resources like that, are really helpful while also providing that live coaching during the session. Privacy and confidentiality are still crucial. Families must have a private safe space to engage in the therapeutic activities at home. And also, creativity and flexibility are essential for success when working with children, especially virtually. So making sure we are adapting the session to be as accessible and as engaging as possible for each individual client. Research strongly supports attachment-based play therapy. Studies by Myers and from 2008 shows improvement in emotional regulation for children with relational trauma. And the study from Bratton in 2005 found that play therapy was highly effective in general. And then most recently, Koloff and colleagues found that attachment-based parenting interventions significantly improved toddler attachment patterns and reinforced the efficacy of this approach. So my program recommendation summary: attachment-based play therapy is an ideal choice for developing a program to serve children, adolescents, and families at our agency. This approach is grounded in decades of research supporting the clinical role of attachment in emotional and relational development. Attachment-based play therapy offers a developmentally appropriate and trauma-informed method to help children express themselves and repair relational disruptions in order to help build emotional regulation skills. It also meaningfully involves caregivers, strengthening the parent-child relationship, and provides long-term benefits for family functioning. Attachment-based play therapy can be implemented effectively with a modest budget, using essential toys and materials that foster creativity, emotional expression, and relational healing. It is flexible enough to serve a diverse population, adaptable across various cultural backgrounds, family structures, and age groups. In addition, its a strong research base supports its effectiveness in improving emotional, behavioral, and relational outcomes. For these reasons, attachment-based play therapy provides a strong, evidence-supported foundation for our agency's new clinical services for youth and families. And here are my references. Thank you for watching.